Hi everyone, welcome to Get Well with Dr. Shel. I am Dr. Shelena Lalji, better known as Dr. Shel, and I know as a board-certified OBGYN and a functional medicine expert, your health is unique and deeply personal. It is a combination of genetics, lifestyle, and environment. Know this, no matter what your starting point is, you are never powerless over your health. Being on a health journey is a marathon, not a sprint. This podcast is about walking you through many different perspectives on health conditions, symptoms, and solutions that can help you get from fatigued to fabulous. My mission has always been to offer my patients and community the best of mental, physical, and spiritual wellness. You can learn more about me and my wellness center and schedule your telehealth appointment at drshel.com. We can support you no matter where you are in the world. This podcast is a powerful and simple way to carry the wisdom of thought leaders from around the world in your pocket and continue to develop your own healing journey every single day. So let the journey begin. Welcome, everybody. I'm so glad you could join us today. We have a great treat for you today. I have Dr. Anshul Gupta with us, joining us today. Welcome, Dr. Gupta.
Thank you so much.
A little bit about Dr. Gupta. He's a board-certified family medicine physician with advanced certification in functional medicine, peptide therapy, and also fellowship trained in integrative medicine as a staff physician. He has helped thousands of patients to reverse their health issues by using the concepts of functional medicine. His dedication towards his patients was recognized when he was awarded Reader's Choice Award, Best Doctor in Northern Neck Area. He is now on a mission to help 1 million people reverse their health conditions. To achieve this mission, he has started a virtual functional medicine practice so he can serve clients from all over the world. He now specializes in treating Hashimoto's disease and helps people reverse their unresolved symptoms of thyroid dysfunction. Conventional medicine does not have all the answers, as we know, for a vast majority of patients suffering from Hashimoto's disease. In fact, it's very difficult to even diagnose Hashimoto's when you don't know what tests to order as a physician. And that's where a functional medicine model can be very helpful. So I know you're going to love this interview. Welcome again, Dr. Gupta. So good to have you here today.
Thank you so much. I really appreciate the opportunity of being on the interview here.
Of course. So let's jump right in and talk about your personal, completely personalized and customized functional medicine plans for people with Hashimoto's, with fatigue, brain fog, and weight loss. Those are the main areas that you dive into. So talk about your personalized approach a bit.
Sure. Yeah. First of all, I want to kind of touch base about, what is going on with Hashimoto's patients and, why they are just not getting better. So traditionally, the approach of Hashimoto's patients that we take from conventional medicine side is that we just treat them by giving the thyroid hormone. We just do not have anything else to offer them. And this is exactly what I was doing for more than 5 years as a family physician, just giving them thyroid hormone. But time and again, what I saw was that these clients of mine or patients of mine are just not getting better.
Mm-hmm.
So then I started questioning, okay, well, there might be something else going on and we need to dig deeper. So
Mm-hmm.
that's where I figured out is that, actually in Hashimoto's clients, the issue is that these antibodies, which are forming in people, they are
Uh-huh.
destroying their own thyroid gland, as well as, an important structure called mitochondria. And nobody's doing anything to fix this connection. They are just trying to pump these females with thyroid hormone, which clearly was not working.
Yes,
So
absolutely.
that's where I started doing more research and kind of figuring out ways to kind of help these females to kind of get better through a
Good.
personalized approach where we fix not only the thyroid, but also the mitochondria.
That's fantastic. And, just for the listeners in the audience, I'd like to just kind of emphasize, Hashimoto's thyroiditis is something where the autoimmune system gets triggered. And just like you mentioned, just to reiterate, your body is attacking your own thyroid gland. And interestingly enough, and you and I both know this because we were practicing traditional medicine in our previous life, I should say, And at that time, what we were taught in medical school and residency is, and this is what most physicians do, you check a TSH and a T4, and that's it. So we were actually taught to not dig deeper. And so we didn't, and most physicians don't. And thus, people with Hashimoto's oftentimes don't know that they have this autoimmune condition until they come to see somebody like us who really dives deep and gets to the bottom of what's going on. And just like you said, you can't just pump people with thyroid hormones. You really need to see, are they getting better, right? Are they losing weight? Are they going to get more energy? Are they going to sleep better? Are they going to have, better energy? Are they going to get rid of their constipation and all hair loss? A big one, right? So many things that happen in Hashimoto's. And if you don't check the proper labs, you're not going to know. So let's, for our audience's sake, let's talk about what are those specific labs that need to be checked, because I want our audience to go to their doctors and be their own advocates and let them know, hey, I would like X, Y, and Z checked. So let's talk about that. What are the labs that you'd like to order?
A very important point that you brought up, it's interesting that, once I saw a pattern in my clients that I was seeing so many thyroid clients in the clinic, and then, nobody knew that they had Hashimoto's or not. So the first question I would always ask them, do you know if you have Hashimoto's? And they would look at me, they said, no. I said, the answer is that no, you don't know, or no, that you have never been checked. And they were like, I don't know, what are you talking about? Right. So that's where I started educating my clients that, you need to be tested properly. It's so common that most of the folks, 90% of my folks have never been checked for Hashimoto's. So, you brought an important point that we definitely need to know the proper test. If you have a thyroid disorder, you need to be checked for Hashimoto's. Yeah. So in that aspect, I have a couple of tests that I always ask my thyroid clients to do. So first of all is the testing for the thyroid hormone itself, right? So most of the people just get the TSH done, but we need to get TSH. Along with that, we also need to get T3, T4, and along with that, something called reverse T3 also. Yes. So that's a complete thyroid profile that I think every thyroid person should get it, whether they are on medications or not. Absolutely. Now the test for Hashimoto's, that comes to check for antibodies, for Hashimoto's. Yeah. And those are two antibodies. One is what we call as thyroid peroxidase antibodies, or what we call as TPO antibodies. Right. And the other one is called the thyroglobulin antibodies, which are also high in that. Correct. So that's the basic test that I think that each and every person who have a thyroid disorder should get it. So that first of all, they get a complete testing as well as they know whether they have Hashimoto's or not. That's a great explanation. Thank you for that. And I just want to clarify for the audience, when you're asking for these tests, and again, to reiterate, TSH, a free T3, free T4, reverse T3, which most of the times people don't get, and then the two antibodies that Dr. Gupta mentioned. This is going to give you a complete picture of really what's going on. And you might have, and this is another important point that I come across all the time, and much like you, 90% of the people I see have never had a proper in-depth thyroid analysis. And what's really heartbreaking is these women and men will come in and, essentially say, I eat right, I exercise, why can't I lose weight? I never have enough energy. I'm always constipated. I'm losing chunks of hair all over the place. I don't sleep well. And I went to my doctor and they said, there's nothing wrong with your thyroid. Your thyroid is, like I say, within normal limits. And so let's talk about that for a second. The range of, let's just take TSH, for example, right? The range is 0.4 to 4.5. And for anybody who knows anything about statistics, that's a huge range. Now, I like to keep my patients below about 1.5, preferably even around 1. I assume you do the same. But I'm also always looking at that free T3, right? Because you could have a really good TSH, a lower TSH, but you may not have enough T3 because you're not converting your T4 to the T3. Instead, you're converting it to the blocking one, which is the reverse T3. So talk about that a little bit. What kinds of things can block the conversion, as you and I know, from T4 to T3, where you don't have enough of the active form of thyroid? Yeah, very important point. So like just for the audience sake, like some people might not know like what is like, the inactive or the active, like version of thyroid hormone. So, like your thyroid produces, like the T4, which we call as an inactive thyroid hormone, which needs to be converted to T3, which is the active version. Most of your tissue use the T3 actually to do all the processes that is needed.
Right.
Now, what happens is that, like the T4 can be converted into either the good form, which is the T3, or the bad form, as we say, which is the reverse T3. So it is so common that, as you mentioned, that people who are taking levothyroxine, which is the T4 medicine, and they are doing great, their numbers look great on TSH, but their symptoms are not good. The
Right.
reason being is that they're not converting it to the normal T3, they're actually converting to the reverse T3. But if you don't check these hormones, then you don't know that.
Yes. Yes.
So that some of the things which actually causes like the conversion from T4 to reverse T3. One of the most important things is stress. So any kind of stress that your body goes through promotes the conversion of T4 to the reverse T3. Now that can be emotional stress, it can be physical stress, it can be stress because of any illnesses. All of those things comprise like in the stress form of it.
Correct.
Then deficiency of certain vitamins and minerals, that is another reason of conversion to reverse T3. So some of those vitamins and minerals could be zinc, could be selenium, all of those things, magnesium. So those are all vitamins and minerals which if you're low on, that again promotes the conversion to reverse T3.
Right.
And the other thing which I've seen very common is actually toxins. So I'm seeing more and more females, which are high in toxins, especially mold toxins. They
Yes.
actually, have very, very high levels of reverse T3.
Right, right. Those are very, very good points. So just to kind of reiterate, we've got nutritional deficiencies, vitamins and minerals. We've got stress, so stress hormone, which is cortisol. And, in practices like ours, we always look at cortisol hormones, the salivary cortisol hormones. And just to kind of spend a minute on that, it's very important to know what your adrenal glands are doing and what your circadian rhythm is doing. The circadian rhythm is sort of how your cortisol is released and how much cortisol you have at different times of the day. And you need to have the highest amount of cortisol in the morning and then lower, lower, and then lowest at night. And that's known as a normal circadian rhythm. When you're off in that, then that can certainly cause that conversion of T4 to the reverse T3 because you're just producing an overabundance of stress hormones or you're in complete adrenal fatigue. So either or. I do want to mention, I'm glad you mentioned the supplements because, all of my thyroid patients, I'm very particular about getting them on the right supplements, and they're always on zinc and selenium and magnesium. Those are three really important vitamins and minerals. And then the other thing I want to say is estrogen dominance, especially in women, right? We see a lot of hormonal imbalances. And when you have an imbalance, and this kind of an imbalance can occur not just in menopause, it can start in your 30s, or 20s even, and go all the way up until, we become in our 60s or 70s, really, because your progesterone declines at such a rapid rate compared to your estrogen. So estrogen dominance is another big component. And that kind of leads me to how, can you explain to the audience, how do sex hormones and thyroid interact with each other? What is
Yeah.
your observation?
Yeah. So what I always call is that, our endocrine system is like a symphony. Is
Yes.
like, all of these hormones are connected with each other and they all affect, like the levels of each other if, one is not happy. So like in a symphony, each and every kind of instrument has its own role. The
Yes.
same way is, is in our body too. So thyroid and our sex hormones are actually very well connected. It's kind of a two-way connection that they have. The
Yeah.
thyroid hormone itself, kind of helps out with the proper functioning of the female reproductive organs.
Mhm.
Especially it balances the estrogen and the progesterone.
Right.
And that's the reason if the thyroid hormone is not in a proper shape, then we see like conditions like PCOS, like endometriosis, a whole bunch of things, which can happen, infertility, with all these females because they're again, sex hormones are totally whack.
Yeah.
And then when these sex hormones like estrogen and progesterone, when they are off, they actually cause to get thyroid hormone even worse. it doesn't allow the thyroid hormone to work properly because they affect the receptors where the thyroid hormone actually works.
That's correct. Yeah.
So
So
that's
it's
where
a
this is a
vicious
two-way
cycle.
street.
Yeah, it's a vicious cycle. One leads to the other, and the other just propagates the next one. The other thing that I want to mention, and you and I are used to doing this, but this is why when we treat a woman or a man who comes to our office with all of these symptoms, yes, we want to look into their thyroid, but in the same manner, if we're seeing this disproportionate T3 and reverse T3, we always want to look at their toxins. We look at their gut health. So the gut microbiome is extremely important because if you don't have a healthy gut, you're not going to be able to convert. We always check for mycotoxins, like you said, for mold. We check for heavy metal toxicity, which is very important, as well as with the adrenals and nutritional deficiencies. So, somebody might say, well, all I want is some thyroid hormone and I'm out of here, right? But really, we do a fairly good job, I feel, of really going to the root cause, because just giving somebody a thyroid hormone is not going to fix the entire microterrain of their body, right? So comprehensive, personalized care is what functional medicine is all about, which is why you and I love what we do, right?
Exactly, yeah. And that's what, like very commonly when people come to see me, they said, like, it's just that, you just need to fine tune my thyroid hormone medicine and I'll be all good. I
Right.
said, well, it was so easy, I would have already done it, or anybody could do it. But unfortunately, it is not. We
Correct.
need to go to the root cause of your problem. First of all, why did you start having the thyroid problem? Because unless we fix it, you're not going to get better. Again, I can fine tune your thyroid medicine for today, but tomorrow they will be out of sync. So
Right.
like instead of being on the thyroid medicine for forever, if we work on your root cause and reverse it, then maybe we might be able to get you off thyroid medicine also.
Exactly. I'm so glad that you pointed that out. And I want the audience to know that, and a lot of patients will ask me, well, if I start this hormone medicine now, do I have to stay on it forever? And I always tell them, your body is a magical thing, but we need to get to the root cause. And if we can repair and fix what caused it to begin with, then you may be able to come off of it, no problem. But we've got to get to the root cause of it. And that really is music to a lot of people's ears, because like us, nobody wants to be on medications for the rest of their lives, right? And so if we can do natural things, lifestyle modifications, and really decrease inflammation in the body and decrease stress, I think that goes a long, long way for our patients. Let's switch gears for just a second. We'd love to hear a little bit about your story of your personal health struggles that got you started in the field that you're in with Hashimoto's and functional medicine.
Yeah, so actually, like I was a very successful family physician practicing in rural Virginia, at that point, and serving the people who needs me the most. But then what I realized was that I was having my own health struggles. I started having, like gut problems, stomach pain. I was fatigued, I was tired all the time. I was gaining weight. And then I was also having like, brain fog issues. And then I didn't know what to do. I initially thought maybe it was just like stomach acid problems, so let me just take some kind of over the counter medications and then see if how it worked. But it did not do anything for me. So I thought, okay, well, I need prescription medications. So I started taking like acid reflux medications prescription wise, but that is also not getting better. So I thought, well, maybe I'm not smart enough. I need to help, get help with the specialists who are smarter than me. So I went to these gastroenterologists, like who did, like scopes and did a whole bunch of testing. Did not find anything. Nothing was wrong with me. And he said, like, Anshul, I don't know what is wrong with you. All the tests are coming normal. Maybe I just need to give you more medications. I was like, I'm already taking medications. He said, well, maybe let's just double it up. So
Oh,
I
wow.
actually increased more medications, but that did not do anything either. I was still suffering with pain and gaining weight, and I was still tired. And I was just 32 at the time. I was like, wow, I'm just 32. I'm having so many health problems. And then do I have to take these medicines for lifelong? I don't want to do it.
Yeah,
That was a very, very scary moment in my life. And because I didn't knew what to do, I had no hope for getting better.
right.
But that's the time, I got introduced to functional medicine, and then I started training in functional medicine. And then that's where I realized, okay, well, there is much more hope for me to get better. And I
Good.
started applying the principles. I changed my diet, took some supplements, started doing some exercising. Within 1 month, my pain was gone.
Good.
And then
Excellent.
Yeah, within 6 months, I was able to get off all medications. My pain was gone. I was able to lose 40 pounds. And
Wow.
I had so much energy that I was able to kind of complete a rugged maniac.
Okay, good. Excellent. So you
Yeah.
practice what you preach, which is what we all like to do. And I think that's we've all sort of had a story, right? That's pushed us into functional medicine from traditional medicine. All of us started off in traditional medicine, and we all sort of felt like we were not doing service, real service to the patients who wanted to get better but just couldn't because we weren't getting to the root cause of the problem. For me, it was a lot of hormonal issues after my son was born, Zaid was born, and I was, 34 years old, and tons of hair loss and hormonal issues and insomnia and feeling depressed and exhausted and just couldn't think straight. And I was a practicing OB-GYN and raising two kids and, trying to balance everything in life. And there was no help. My doctor just wanted to put me on a sleeping pill and an antidepressant. And I knew that that was not what was missing in my body. My body was not craving antidepressants and a sleeping pill. And so just much like you, I had to, do my own thyroid testing, really dive into my hormonal balance, check my cortisol, check my nutritional deficiencies, changed my lifestyle, changed my diet, changed my supplements, and really just focused on more lifestyle measures. And lo and behold, everything was just great. Everything was back to normal. And it really just kind of allows you to think, if we as physicians, right, could not get ourselves better, I feel for the millions of people out there that don't have the same training that we do and don't know where to go to find real answers. And obviously, every physician does their absolute best to help patients in the best ability of theirs, right? But unfortunately, I think our training is a little bit flawed where we never took a course in nutrition. We never took a course in gut health. We never believed in it. We were never taught this stuff. So we had
Absolutely.
to learn it. Yeah. And I'm so glad you mentioned your journey because it's important for patients to know and for the listeners to know that we too, we're doctors, but we're also patients, right?
Mhm.
We're real humans and we go through the same stuff that other people do. So we speak from experience. I want to also, before we shift away from Hashimoto's for a little bit, let's talk a little bit about what are some of the particular things we do for Hashimoto's versus just, regular clinical hypothyroidism. Let's talk about maybe things like low dose naltrexone for Hashimoto's and the diet where we really need to avoid gluten because we know over 95% of patients with Hashimoto's have gluten sensitivity. So if you can touch upon that a little bit, what are some specific things that Hashimoto's patients should know about?
Sure. Again, so in Hashimoto's, as we said, it's an autoimmune condition, right? While, like a clinical hypothyroidism, can happen because of Hashimoto's, can happen for a number of reasons, right? So in that situation, sometimes thyroid hormone is needed. But in Hashimoto's, if we do not work on the autoimmunity, your thyroid gland is just going to get destroyed, like time and again. And ultimately, it will be very, very difficult to revive it. So
Yeah,
that's what we need to work on, this autoimmune piece, special over there, so that we can stop the destruction of the thyroid gland. So
yeah,
in that aspect, definitely food plays a pivotal role. And that's where, like I have made this kind of, what I call as a mitothyroid diet, which is the basis of this diet is that three prong. First of all, it basically removes food, which kind of leads to the triggering of the autoimmunity, which we kind of discussed. Gluten is definitely number one, but after that, I feel dairy is the second one, which causes that. Then processed food, like especially processed, like meats, red meats and things. Then, like soy, corn, sugar,
yeah.
all of those foods, are big triggers, for Hashimoto's folks, and they
Okay,
definitely need to stay away from that so that, we can stop, any more autoimmune process going on.
right, right,
And then second of all, what we need to do is that we need to start kind of, rejuvenating the thyroid as well as the mitochondria. So that's what the second step that we need to do.
right.
So in that aspect, we need to include foods which supports them, which includes, like anti-inflammatory foods, like non-starchy vegetables. Like, for my clients, always says more than half of your plate should be filled with vegetables. Like,
Right.
so what your grandma was saying that, eat your veggies. So she was right over there. So
Mhm.
make sure you get all those veggies in, and then good fats, like we need all those good omegas, and good omega 3s and good fats so that it can reduce inflammation. So we definitely work on all of that aspect too. And
Yeah.
then some antioxidants, like to again reduce inflammation, which are like, again, low carb, like fruits, like berries, blueberries, are wonderful in that aspect of it. Then we also work on some chia seeds and flax seeds to give them, like some fiber and also reducing inflammation in that aspect. So that's what, like from the diet aspect, I think is very, very important for all the Hashimoto's clients to remove food which is destroying their thyroid and Hashimoto's, and then include foods which is going to be healing for them.
That's fantastic. Thank you for that overview. I want to kind of also iterate that this kind of a program, this kind of an eating program that supports your mitochondria is great for Hashimoto's, but it also is great for really any autoimmune condition that you might have. It is also great for people who have chronic fatigue, or if they have brain fog, or if they have neurodegenerative conditions, or if they have cancer, even because these kinds of foods, the anti-inflammatory foods and the pro-healing foods, right? So when you talk about the veggies, you're talking about a lot of the cruciferous vegetables that we know are so high in all the good micronutrients. And then the healthy fats, like you mentioned, whether it be salmon and, wild Atlantic salmon, not just any kind of salmon, but also good MCT oil and avocado and coconut oil and things like that, that are going to really, and some of the really good nuts and seeds are going to be really important. So it is true, you are what you eat. And it's amazing when you follow a diet like this that is pro healing, what your body will do as a response to it. It truly will start healing, and it's miraculous because you're giving it the macro and the micro nutrients to support the mitochondria. So that's really, really great that we're talking about that. Let's also kind of talk about, what does the mitothyroid connection, why does it get disrupted to begin with in Hashimoto's patients? And why is there such a big connection between the mitochondria and the thyroid?
Yeah, so let's first start with like, what is, this connection between like, thyroid and mitochondria. So like in mitochondria, for just for our listeners, like, we have just heard in our biology class that it's a powerhouse of the cell. So basically like, we know mitochondria basically produces energy. But in the recent years, the research has actually shown mitochondria does much more than producing energy. It is involved in like anti-aging processes. It is involved in autoimmune processes. It is involved in metabolism. So, like, we are knowing more and more about mitochondria. So now the connection between thyroid and mitochondria is kind of what we call as, like in a connection, you can compare it like, a gas pedal and an engine in a car.
Yeah.
So your gas pedal is your thyroid and your engine is your mitochondria. So like, we feel that, like the more gas pedal you push, your engine should, like give you more power and you should run.
Right.
But if your engine is not working, doesn't matter how much gas pedal you're going to push, like your car is not going forward. So that is what is happening in these Hashimoto's patients, is that their thyroid hormone, we are giving them more thyroid hormone, and we are hoping that the mitochondria will start working, and that will give them more energy, that will give them more mental clarity, that will help them to lose weight. But in reality, we are not doing anything to help the mitochondria. So that's the reason all of these symptoms persist.
Exactly. Very well put. It's kind of made me think of Ford versus Ferrari for some reason. You've got a Ferrari engine. Well, you've got to make that engine and keep that engine very, very strong. And that is true. Like a lot of people don't really understand that our body needs that, at a cellular level, it needs support. Because if we don't support it at the ATP and the mitochondria level, then there's nothing to be able to recharge itself. And you
Mhm.
can keep on, it's almost like you keep on pumping things from the outside, but the inside is just not able to respond because it's broken down. Um, so that was a really good explanation. Thank you for that. Now, just to kind of summarize everything, I want to just leave the listeners with some of the symptoms that are very common in thyroid conditions, especially with Hashimoto's, and also just regular hypothyroidism that we see all the time. So we've talked about fatigue, we've talked about weight gain, we've talked about brain fog and insomnia and constipation and hair loss and depression. Am I missing anything for the audience to really think about as far as if they have these symptoms and they really need to try to get to the right person to get the right testing done?
No, I think, like you put very well all the symptoms, like mood changes is very important. Infertility is very important, like female, like menstrual issues, I see hair loss issues or hair thinning issues. So all of those things, like, being feeling cold or temperature changes, those are again, important symptoms that we see a lot of times with Hashimoto's or thyroid clients.
Absolutely. And so once they feel like, they might have this condition, go to your doctor, choose somebody who has a background in functional medicine, and ask for these specific labs, and perhaps also ask for the other labs that we spoke about with the mycotoxins, the mold, the heavy metals, the nutritional deficiencies, the hormonal check, and the cortisol check. And when you have all that information, you put it together. I know you have a three-step process for Hashimoto's patient. How do you sort of outline the three-step process and explain it to the listeners, please?
Yeah, so in the three-step process, what we do is that the first step is figuring out why that mito-thyroid connection is broken or why they got Hashimoto's. So
Right.
in that aspect, like we kind of go down all the triggers which might be possible. So in that aspect, the first thing is the food. So food sensitivities is very common. So we kind of make sure that we go down that list and figure out if they have any food sensitivities which are destroying the thyroid gland.
Sure.
The second thing is nutritional insufficiency. So if they are deficient in certain vitamins and minerals, that will again going to harm their thyroid and also causes autoimmunity.
Hmm.
Then the third thing we look at is obviously the toxins. We spoke about heavy metals and mold toxins and all those things. So again, we look at if they are the reason of destroying the thyroid gland. And the next thing we look at is infections. So, like there are several infections which have been associated. The most common being the Epstein-Barr virus infection or infectious mononucleosis, that has shown to be connected with, Hashimoto's. And
Right.
then there is Lyme disease and other chronic infections like the Babesia and Bartonella, which again can cause it. And in the last, we check the stress, like as you mentioned that, the salivary cortisol test can easily be done, which again tells us whether that person's body has adrenal fatigue or not, or that stress is causing them to have Hashimoto's. So this
Right.
is the step one, where we figure out what triggered their Hashimoto's. So we do a comprehensive evaluation in that.
Good.
And the second step is basically where we start kind of, improving their mitothyroid correction or rejuvenating the thyroid and the mitothyroid.
Hmm.
In that, we start the diet, which we spoke about. We eliminate food which are causing inflammation and introduce foods which reduces inflammation and helps to rejuvenate the thyroid and mitochondria.
Hmm.
Along with that, we also give them supplements, which are beneficial for the thyroid as well as for the mitochondria.
Good.
And in the third and the final step is what we call as a final purge, where we kind of help them to detox, like in a more safer and a gentle manner to get all those toxins out. We rebuild their immune system so that, like the autoimmunity goes down and the thyroid destruction doesn't happen anymore. And obviously, we work on the stress management techniques so that in the future, even they get exposed to stress, their body doesn't respond in an inflammatory manner. So that's where, all these three-step process, we kind of starts from identifying the problem to
Sure.
kind of, fixing it, and as well as kind of taking a long like approach so that they don't get it again.
That's fantastic. So, that's sort of functional medicine, put it in a nutshell, right? So you've got the root cause, you do the right testing, you change lifestyle modifications, so diet, exercise, meditation, yoga, stress management, and then you make sure that the right nutrients are in place, and you want to prevent from it from happening again, so that we have a better, more resilient system in place. So very, very good. That was wonderful. Thank you so much, Dr. Gupta, for sharing all this wonderful knowledge with our listeners. I know you have a great thyroid quiz on your website. Dr. Gupta's website is AnshulGuptaMD.com. We'll share that in our notes and the podcast notes, as well as a link to his quiz. And would you like to say any parting words, Dr. Gupta?
No, I think, like I would like to know the listeners that, the quiz is very fun. It actually gives you some idea about the root cause because, like we spoke about those things in a very, very fast manner. And for a lot of people, that might be like, something a total new language. So the quiz is a good way to kind of get you introduced to the concept of root causes. So, like you can, take it. And the last thing I always want to say is that you might feel that you are alone and you might feel that there is no hope for you, but in reality there is hope. There is no reason for you to suffer endlessly the way you are suffering right now.
Absolutely.
If you follow the right steps and the right protocols, then things can get better.
Awesome. Thank you so much. It was a pleasure having you here today, and hope you have a great day. And thank you, everybody, for listening. And we will catch you again in our next session. Take care. Thank you so much for making time for today's podcast with Get Well with Dr. Shel. I know that this conversation and education can help you to create your best life possible on every level. So definitely tune in to hear the newest expert and learn the latest protocols to support your best health journey. You can learn more about me and my wellness center at drshel.com, drshel.com, and I hope that you will make time to come visit us in the Houston area to take a deep dive on self-care. My team and I are completely devoted to helping you live a better life from this moment forward. The best days of your life are ahead of you, I promise. This podcast is a powerful and simple way to carry the wisdom of thought leaders from around the world in your pocket and continue to develop your own healing journey every single day. So let the journey begin.